We've often turned to you to help us make sense of things in this time of uncertainty, and there's some confusion over this. So you got the quote yesterday at that NACI briefing that mRNA vaccines are the preferred vaccine because there is a safety signal, a safety risk, that extreme rare complication of the blood clots linked to the other types of vaccine. But if you have that preferred vaccine statement, put it up beside the messaging that the Canadians have been getting for months, even as recently as mid-April from Health Canada, get whatever vaccine is available to you. It's that simple. Is this a contradiction?
There are some contradictions here, Heather, unfortunately. And in terms of that message, I guess the Prime Minister, the Deputy Prime Minister, the Premier of Ontario, the Deputy Premier, leaders of the opposition, countless doctors I know, they all missed the message. And I really worry about a situation where Canada will be the only country in the world where we managed to create buyer's remorse about a vaccine we've provided free of charge to Canadians to protect them from this very unpleasant disease. Part of this is about the safety signal, but it is, as you say, very rare. It's also about NACI's characterization of the effectiveness of these vaccines. And they have decided that the mRNA vaccines are superior in efficacy. And I just have to say to you, that's a very problematic position to take, because all these vaccines do extremely well at protecting people from serious complications, including hospitalization, ICU admission, death. There's very little to choose between them. Any difference occurs in the mild end of the spectrum of COVID. That's not trivial. But here's what the FDA said, Heather. I just want to share this with you.
Okay.
The FDA said, in response to their frequently asked questions, can you make comparisons about the effectiveness among the 3 COVID-19 vaccines that the FDA has authorized? That includes Janssen, which they were talking about yesterday, lumping it with AstraZeneca. And the answer from the FDA is no. The only way to accurately compare the effectiveness of medical products, such as vaccine or drugs, is by direct comparison and head-to-head clinical trials, which hasn't occurred. And they go on to explain, as is obvious if you look at the trial data, that there are quite definite differences in the populations and the context, even the strains, when these viruses have been tested in randomized trials. AstraZeneca, for example, the relevant subgroup, people who wait 12 weeks for a booster, shows 82% effectiveness. And it was tested in England in a period when the B117 strain was becoming prevalent. Nothing like what was happening with Moderna and Pfizer when the US trials were done. In fact, the placebo attack rate of COVID is much higher in the UK trial than in the US trial. So you can't make these comparisons. The only thing that matters here, I think, is the side effect, which is very rare.
7 cases now in Canada of this blood clotting issue. But again, come back to the phrase that you used, if you would, Dr. Naylor, buyer's remorse, because that is what we're hearing, social media posts and people writing into us, and even, colleagues of yours, doctors in Canada. The concern is that Canadians feel they've made a mistake, and we're hearing that from Canadians themselves. They've used the words unsettled. They feel betrayed by all of this. I mean, what are the consequences here?
I think the consequences are unfortunate because we have some vaccine hesitancy in this country, less than I think in our neighbor to the south. Canadians are relentlessly sensible. They've been troopers through this whole long siege, and I think they're up for getting the jabs, many of them as fast as possible, thank heavens. But I do think it is an unsettling message because it suggests that you got the second best vaccine. And particularly if you're saying there's a trade-off here where higher risk areas should somehow be more likely to get one of the viral vectored vaccines. The signal sent there is also a bit confounding in terms of equity. If you really believe these mRNAs are so much better, then give them to the highest risk populations.
That's a really good point, isn't it? I mean, you're talking about if you can afford to, the comment from NACI, if you can afford to wait. But the people who can't afford to wait are people in hot zones, often racialized communities, people in essential workplaces, often lower socioeconomic and racialized Canadians as well, younger Canadians, and perhaps interpreting this as they're getting a subpar vaccine here.
Yeah, and it's a terrible signal. We also have the Janssen situation, where this is a one-shot vaccine. That's really handy if you're dealing with populations where there's a degree of transience. If you're dealing with homeless populations, especially as the weather is getting better, not all homeless people are keen to stay in the shelter system, as great as it is in so many ways. And so you've got, a challenge here where a one-shot vaccine can give protection to those of our citizenry who are underhoused, who are vulnerable. And yet the signal being sent is that's a second-class vaccine. And you look at the efficacy data for serious complications, I don't buy it. And if you look at the overall efficacy data, someone who got AstraZeneca, who's recommended it to many colleagues, I'm very happy. I have no buyer's remorse. I would just reassure Canadians, this is a fine vaccine. 60% of the doses given in the UK to break that third wave with B117, where the AstraZeneca vaccine. It does have this rear side effect that has to be taken seriously. But, in general, let's not get into Gucci versus Rolex versus no-name branding of vaccines based on questionable effectiveness comparisons. And let's not make what really are reverse equity mistakes as we roll this out with conditions.
Who should Canadians be listening to?
Well, right now, I think we're going to have to clear the air on this latest set of announcements. I do see the logic. I have a lot of respect for my colleagues on NACI, admiration actually for the sacrifice they made during this pandemic. So I think now we have to listen to the provinces to see what the vaccine task forces at the provincial level and the chief medical officers of health have to say, what policies they adopt. I'm confident we will find our way through this, as we always do, as we have so resiliently throughout this whole pandemic. And I think NACI's had its say. Now some of us can present a slightly different view. The public can hear everyone out and listen as well to the health officials in each jurisdiction who will make a considered judgment as to what is best and safest and most effective for the people under their care.
It's so hard to determine what is the best course of action when there are so many sorts of messages and mixed messages coming at Canadians in this uncharted territory for everyone.
Just say, Heather, the basic message is still take the first jab you get, unless you're under 30. If you're under 30, think about whether or not it would make more sense for you to go with an mRNA. That's the bottom line here, especially Ontario to the west, where we still have third waves that are severe. That's a general rule of thumb. You want to go from there and, get into your brand shopping. Okay, that's your call, but I still would advise take the first jab you can get if you're in Ontario or anywhere west or over 30.
You wanted to point out, as we were having discussions earlier off camera, that there are a couple of other things you considered important coming out of that NACI briefing. There was guidance for pregnant women and guidance for Canadians who have already had COVID-19. Why don't we address both of those?
Yeah, this is, again, where NACI is so valuable, despite the frustrations and some of these complex issues where, they're really navigating uncharted waters, in fairness. The pregnancy guidance is very smart. If you were to have one of these rare clotting events, as rare as they are, in the context of pregnancy, it would be very hard to manage. You could have 2 lives at risk. So they are recommending mRNAs for pregnant women. And I think that's a prudent and smart recommendation. Very simple, very clear.
Okay.
I thought that was a good one.
And for those who've been infected, just to bring people up to date, the science had been, or the thinking had been, that if you have had COVID-19, then you only need 1 shot of the vaccine because the infection effectively is your first immunity, and then the second or the first vaccine is sort of your booster. Now the thinking on that is changing.
I'm not sure it is changing.
Okay.
I think they put out a precautionary statement to avoid having people assume they can get away with 1 dose if they've had COVID in the not distant past. I think, again, that was prudent. I would have been happier, and I told them this in the briefing beforehand, if they messaged it by emphasizing that this one could change. What you see is if someone has had COVID fairly recently, symptomatic COVID, and they get a shot after that, they have a very robust immune response, more commensurate with what you see if someone had a primer and a booster, 2 shots. So it could be that we will get to a point where we go with the 1 shot, the single shot as a booster equivalent. We aren't there yet.
Okay.
And they're just really asking people to be patient for now. That's fine, but I wish they'd put it that way too. Another communications issue in my view.
Well, you've made that point on numerous occasions, and thank you for making it again this morning and helping us understand it a little more clearly. The bottom line from Dr. Naylor is get whatever shot it is that is available to you still. That seems the best guidance. Thank you so much, Dr. Naylor. Really appreciate it, as always.